Our cardiovascular system is a closed system of tubes through which blood circulates in our body. That is, these are arteries which carry blood from the heart to various organs and parts of the body. These are veins which carry blood from the organs and parts of the body back to the heart. These are capillaries where the artery transitions into a vein and blood supply takes place. And this is the motor or pump of our vascular system, the heart, with a rather complex structure and complex functions, which we have discussed in several previous videos. And our vascular system is filled with a certain amount of blood. You should understand that blood makes up 5% of a person's body mass. Well, approximately. So if your weight is 90 kilograms, you divide 90 by 10 and then by 2, and you get 4.5 liters of blood. A certain amount of blood is poured in there. Moreover, blood consists of blood cells, erythrocytes, a small number of leukocytes, a bit more platelets, and blood plasma, in which proteins, minerals, and electrolytes are dissolved. And blood plasma can seep through the vascular wall in either direction. Therefore, the composition, or rather not the composition, but the amount of blood can change a little in the vascular system, but not due to the red blood cells, rather due to the blood plasma. And a mandatory condition is that the vascular system must be hermetically sealed. Hermetically sealed. If the vascular system loses its seal, bleeding occurs because the blood is under a certain pressure. And when the vascular system is no longer sealed, blood starts to flow out through that opening. In other words, when bleeding occurs due to loss of seal, I should immediately note that it requires stopping. And essentially, since the blood is in a closed vascular system, it is under a certain pressure there. But we need to understand that the pressure in the vascular system is not constant. Firstly, because the actual amount of blood changes due to plasma seeping both into and out of the vessels. And also because the pressure inside the vessels is determined by the condition of the muscular layer of the vessel walls themselves. And that's precisely why the critical state of the blood pressure, specifically the pressure within our vital blood vessels, is an exceptionally important physiological factor for maintaining optimal human life activity. That is, if the pressure there becomes very, very high, the vessels can burst at a certain place and at a certain time, and this will cause, bleeding. This can lead to some kind of hemorrhage, or could even result in death for a person, for example, if the hemorrhage occurs in the brain. That's why the parameter of blood pressure is vital for the human body. Today in this video we will go over how blood pressure is actually measured. In front of you is a very old Rivarocci device. You know, friends, it's called a sphygmomanometer. When I look at this device, I immediately remember that Dr. Holod Vladimir Miroslavovich used to work with such devices. I used to measure grandmother's blood pressure with this same old sphygmomanometer. Every time I see this device, it immediately reminds me that I'm already an old vintage doctor. If you still use this kind of device and remember them, it's probably time for us to retire, because this is really just history now. What was the essence of this device? So, a flexible cuff with a soft rubber balloon was carefully put on the upper arm, specifically on the shoulder area, and you could then easily pump air into it, and the precise manometer clearly showed to what exact pressure the mercury column had been pumped up. That is to say, precisely how much air was contained within the cuff at that moment. And the mandatory condition was that the cuff had to be inflated so much that it completely blocked the artery, the brachial artery that carries blood to the arm. After you had pumped in enough air to completely compress the artery, you would slowly start to release, you would start to let the air out of the cuff. And at this point, as you can see, we used to determine it by feeling the pulse. But over time, we started to use a stethoscope, checking at the bend of the elbow, and we were supposed to hear the pulsation of the artery. That is, at the moment when we have completely compressed the blood flow, and at the moment when the blood first starts to break through the artery compressed by the cuff, we record on the mercury column. We record the upper arterial pressure. So we release, having pumped it up to 160, 170, and now I release to 150, 140, 130, 125. There, 120. And I can already feel how the first pulse wave starts to break through. This is when the upper arterial pressure is recorded. Arterial pressure, the pulse wave starts to break through, and at the same time I hear a certain tapping sound. This tapping is the artery breaking through, so to speak. The blood in the artery is breaking through the tightness of the cuff. But then I lower it further, keep releasing the air, and at a certain point, while listening with the stethoscope, I stop hearing this tapping. This means that the cuff pressure is now such that it no longer interferes with the blood flow in the artery at all, and at this point the lower or diastolic pressure is recorded. So I release it to 110, and they're still tapping. 190, the tapping is still there, 80, and then I stop hearing the tapping. And then I record that this is now the lower pressure. A person's blood pressure is always recorded as two numbers, the systolic or upper pressure. This is the moment when the heart pumps blood, and the blood rises through the arteries, through the aorta and the brachial arteries. This is when I record the upper pressure. The upper pressure is also called the cardiac pressure because it reflects how forcefully the heart has pumped the blood. And then when the heart relaxes, the blood returns to the heart but encounters a barrier in the form of the heart valves. And at that point, the lower pressure, which I record, indicates how much blood is in the vessels, and the amount of blood in the vessels, the amount of blood plasma, is determined by how much salt has been removed from or remains in the blood. And to some extent, the lower pressure is determined by the condition of the kidneys, and the lower diastolic pressure, when the heart relaxes in diastole, is also called renal pressure. So it drops to 80, and I note that the tapping sounds have stopped. This means that the person's blood pressure is 120/80. This is not the norm, don't get me wrong. These are average values. And I can further supplement these readings with a third number. This is the pulse pressure. Pulse pressure is the difference between the upper value, 120, and the lower value, 80. I subtract 80 from 120 and see that the pulse pressure is 40 millimeters of mercury. That's where the millimeters of mercury come from. That's where these numbers are taken from. And now we use a device to measure blood pressure. The device is called the Korotkov apparatus. Well, the Korotkov apparatus is basically the same thing, except here we pump air into the cuff compresses the brachial artery, and blood stops flowing into the arm. Of course, this causes ischemia in the arm, but we're not going to measure blood pressure for a very long time. It's not fatal if the arm goes without blood for a minute. At the same time, I place the stethoscope on the bend of the elbow and slowly begin to release the air. In this case, there is no longer a mercury column. Instead, there is a manometer dial that shows the pressure to which I inflated the cuff. So I pumped it up to 160. I still hear the beat, 170. I still hear the beat, 180. There's no beat, so I pumped it up until there was no beat. Then I slowly release the air and see that the beat reappears at 170. Oh dear. We write down systolic is 170. I keep releasing, and at 110, the beat is no longer heard. Then I record the diastolic as 170/110. We have elevated blood pressure. Unfortunately, I'm just showing you historical examples here. Well, to be honest, fewer and fewer doctors are using this method nowadays. Now, there are electronic devices. A person puts the cuff on their arm just the same, presses a button, and it automatically inflates, automatically deflates, and records the measurement. It electronically detects the moment when the bloodstream starts to break through the compressed artery, when the cuff stops compressing the artery, and immediately records your upper pressure as 108 over the lower pressure of 69. Often the pulse is also measured right away. 78, the device calculates it automatically. Although it might not be able to measure the pulse if there are signs of atrial fibrillation, as it's very difficult to calculate in that case. With atrial fibrillation, you need to listen not to the pulse. Guys, keep in mind that with arrhythmias, it's hard to calculate automatically. You need to count the pulse by listening to the heartbeat with a stethoscope. Well, I got a bit off topic from hypertension. So let's go over a few points related to blood pressure and the normal ranges for a person. All right, take a look. There is no such thing as a normal blood pressure of 120/80. There isn't. That's nonsense. That's just an average blood pressure. People just memorize that number, but it's nonsense. So like they say, like an astronaut. But what does like an astronaut have to do with anything? The goal for strong people who were sent into space was not to have a blood pressure of 120/80, but to have a pressure that reacted less to changes in environmental parameters, atmospheric pressure, physical exertion, and changes in temperature and humidity. That's what astronaut-level blood pressure means, not 120/80. Normal blood pressure can't be just a single number. After all, there can be a range among people. That's why normal blood pressure is defined as a range from one boundary to another. And that's why systolic or upper blood pressure is always considered normal, from 100 at the low end to 140 at the high end. So for example, if you measure a person and get 100, 110, 120, 130, 135, 138, that's all normal blood pressure up to 140. And anything above 140 is considered high blood pressure. Anything below 100 is considered low blood pressure. The lower or diastolic blood pressure has its own normal range, from 60 to 90. So if your blood pressure is below 60, 50, 55, that's low blood pressure, that's hypertension. If your blood pressure is above 90, say for example 130/100 or over 100, that means your lower diastolic pressure is high. Since this is related to the kidneys, you should pay attention to the condition of your kidneys and how well they filter salts from your blood. And blood pressure does not depend on age. From 15 to 90 years old, this is considered the normal blood pressure range. Yes, children have completely different blood pressure parameters. I won't go over those with you right now. We don't need that for now. We're talking about adults, and it applies to everyone individually. It's nonsense when someone says, for me, 150/100 is my normal working blood pressure. Nonsense. Complete nonsense. Because this simply means that the human body has adapted to living in a state of illness, and it doesn't feel or show any symptoms. By the way, that's very bad. Usually, an increase in blood pressure is still felt by a person as headaches, heaviness in the head, a sensation of pounding, sympathetic symptoms in the heart like palpitations, sometimes arrhythmia, sometimes a feeling of pounding or fullness. Well, there are various signs. We'll talk about this as well in the next videos. But when a person doesn't even feel high blood pressure, that's a very, very unfortunate condition, because it means the person has already gotten used to living with high blood pressure for a long time. In that case, there's a high risk of vascular catastrophes like heart attacks or strokes. That's why, friends, today we're looking at this green area. This is the norm. 100, 140, 60, 90, these are considered normal values. Sometimes when talking to people, I ask them what normal blood pressure is. But since we're dealing with hypertension, I always say that the norm is 140/90. 140/90? In other words, this is the concept of the norm, where we determine whether we are still within the normal range or have already crossed its boundaries. So an upper pressure of 140/90 is considered normal. A lower pressure of 100/60 is also normal. And everything within these limits is considered normal, regardless of how a person feels. Because if you feel unwell but your blood pressure is within the normal range, then it's not hypertension or hypotension, but rather vegetative vascular dystonia. And that's a completely different condition, and it is treated differently. But friends, as for what hypertension is, how it manifests, and why it is dangerous, I think we will talk about that in the next video. That's all for today. Stay tuned to the Dr. Golod Health Academy channel. We will continue to discuss the topic of hypertension and in general cardiovascular diseases for some time. Well, that's all for today. I bid you farewell for now. Always yours, Dr. Volodymyr Myroslavovich Holod.